Number 5, please come up.
I'm not used to using these, so where this needs to be. Hi, my name is Judy Gerrity, and I'm here with my husband Mike and my daughter Kayla. Our story began when my husband went in for a prophylactic MRI. This was to rule out our familial arterial venous malformations. What has followed has ruined our lives. Within days of his diagnostic test, he presented with many symptoms that would continue to get worse. He developed bulbar symptoms, a severe speech ataxia, tremors, and seizures. He went from being an intelligent businessman to a shell of his former self. We sought help, from many types of doctors and specialists. He was diagnosed multiple times, and all other diagnoses were eventually ruled out. At that point, we had to think outside the box. We sought out doctors who did testing that insurance did not cover. That was when we decided to have a provoked heavy metal test done. When we did this test, we thought his neurological problems could have been environmentally triggered. This test was performed a year after his last set of MRIs with contrast. This is an important part of Mike's story because a provocation agent was EDTA, rather than the more effective chelator known as DTPA. EDTA has a much weaker bond to gadolinium. Therefore, its affinity to bind with gadolinium over the original chelator in the contrast agent would have been impossible unless the gadolinium had disassociated and was in its free state. The only way for the EDTA to latch on to the gadolinium was if it were in its free raw state. Let's face it, we all know that you cannot pull something out of the body that does not exist in the body. The measurement you get from the heavy metal test is not the total amount the patient retained. It is only relevant to what you are able to pull out of the body in a 2-hour EDTA chelation treatment and excrete out of the body over the next 8 hours. The only way to know the total retained would be up on autopsy. Free gadolinium is proven to be neurotoxic, hepatotoxic, and cytotoxic. His results revealed a 17, which indicated a large amount of free gadolinium had remained in his body a year post-MRI. It took us several more years to realize exactly the part this elevated toxin had played in the decline of his overall health and symptoms. After much research, I recently discovered scientific data that revealed animals presented with the same symptoms as my husband after being injected with gadolinium. They presented with Parkinson's-like symptoms, tremors, cerebellar atrophy, and seizures. He was previously an athletic man in his 50s with a picture-perfect health, his whole life. We own and operate several businesses in the Kansas City area, and his day-to-day life was filled with many executive duties. He also enjoyed an active social life and was involved in many sports activities with family and friends. Today, he resides full-time in a wheelchair with tremors and speech issues. I have become his full-time caregiver. He has had many falls in the past years, and we've had to make our house handicap accessible as his condition declined. The impact that this has had on our lives and our marriage is one that most marriages cannot endure. We're left to the constant stress of knowing and anxiety of not knowing what our future holds. We've spent hundreds of thousands of dollars trying to figure this out, and the money we were saving for retirement. We're small business owners, and so we pay amongst the highest premiums in the country. And that's because small businesses do not have the luxury of spreading the risk like large companies. I could accept some of this if the insurance industry recognized his condition, however, they do not. They pay to put the toxin in, but they do not pay to take the toxin out, or any modalities that have proven to help patients reverse their neurological symptoms. That being said, you have the power to save lives of many victims. Science has proven that DTPA works much more effectively at removing the gadolinium from the body than EDTA. DTPA is already FDA approved for plutonium and americium. If it remains in an off-label status, doctors are going to be reluctant to administer it. we need now. We do not need it 5 years from now. I want to stress the urgency of this matter because free gadolinium left in the body will lead to mitochondrial dysfunction, cytokine damage, calcification of the vertebral arteries, and it also blocks calcium channels. These toxicity issues are progressive. Please do the right thing by fast-tracking the FDA approval for the use of DTPA, and if you're not willing to remove these agents from the markets, at least considering making it part of a mandatory part of the MRI protocol to chelate post-test. It truly is our only hope. And let's face it, no aspect of this issue is transparent. Patients are highly unlikely to figure this out on their own, let's face it. It is your duty to make sure every patient injected is safe. Thank you for your time.